Shuls Open. So I think it's important to think about it like this. Again, I'm going to be giving my personal view, not necessarily the Shul policy, but my personal view on will Shuls open. Shuls are complex institutions, and many people come to shuls for various different reasons. Some people come to shul because they want to socialize. Some people come to shul because they want to daven. Some people come to shul because they want a sense of belonging to something. Some people come to shul because they're bored. And when you go and open a shul, you have to ask yourself what you're opening it for. Now, there's three main functions that a shul plays: a place of davening, a place of learning, and a place of socializing. Okay? Now, which one of those are we going to be able to do under the current climate? The consensus amongst the chief rabbi and all the rabbis is, and the government, that only services. So no socializing and no learning. In other words, learning will be staying on this platform for the foreseeable future. My gut tells me even after Corona is over, it's going to be very hard to convince people to come out to learn. It's much more comfortable to sit in your house and go on Zoom. So learning is not happening on this platform. Socializing is not happening on this platform. So what is? Davening. And davening in very strict boundaries. In many shuls, there's not even giving out aliyahs. The Baal Korah reads the whole Torah portion for himself. In many shuls, and chances are the policy will be likewise, you come in halfway through the service, let's say yishtabach, you daven, and the moment you're finished, you have to leave. No socializing, no handshakes, no hugs, no pretty much talking, no singing. The singing is dangerous. No choirs on a Shabbos. No chazan, just like a guy gets up, does the service quite quickly. Definitely not a slow service. So then you have to ask yourself a question, and that is, once you open, is it worth it? That means, let's say you have to open under those circumstances. Is it worth it? What experience will that give people? What experience will people walk out with? So some people might say, and they'll right away come with clarity, that what do you mean? As long as the shul's open, it's fantastic. And I respect that opinion. There's validity to that. But if you just saw the letter that Dr. Karen Katz from our community sent out today, it was published in the Jewish Report. So the point is that I'll read you actually what she says. It's quite strong. She signed a letter together with all the pulmonologists in her organization, and it's on the Jewish Report. And let me share it with you. Here we go. Okay, so this is what she says. Most people will have noticed that the number of confirmed cases of coronavirus in South Africa and Gauteng has been rising fast. Unfortunately, this goes hand in hand with a rising death rate. What's readily apparent to the frontline physicians of the Netcare Linksfield Hospital is that the number of admissions related to COVID-19 have increased exponentially. Dramatically, and both the COVID high care intensive unit as well as the COVID general ward have had a much higher number of patients than a mere 3 weeks ago. Hatzalah has also issued a warning about the surge in the number of cases in the community in the past week. We have no way of knowing exactly how many people there are who are actually infected with the virus in South Africa. As of 13 June, there were 65,736 reported cases in South Africa, 9,897 in Gauteng. We do know that about 10 to 20% of patients with SARS-CoV-2 require admission. The National Institute for Communicable Diseases COVID-19 surveillance in selected hospitals, not all hospitals in South Africa are submitting their data, report that on the 13th of June, there were 2,263 admitted patients, of whom 329 were intensive care and 135 on mechanical ventilation, of which 80% of people who go on mechanical ventilation, they don't right over here, but at least in Israel, and don't survive. As of 13 June, 1,423 people have lost their lives to COVID-19, with just more than 50% of the deaths being in the 50 to 69 age range. That's quite shocking because everyone's saying 70 and older. Looking at it in a different way, people between 50 and 59 have a 3.7 case fatality rate. People between 60 and 69 have an 8.9 case fatality rate. And people over the age of 65 have a 14.5 case fatality rate. So although the bulk of deaths are in the 50 to 69 age range, it reflects the fact that the highest numbers of admissions occur in that age range, whereas 1 in 7 people over the age of 70 have died, and about 1 in 11 people between 60 and 69 have died. An additional compounding factor is the presence of comorbidities like hypertension, diabetes, obesity, chronic obstructive pulmonary disease, and so on. A simplified way of looking at this is that if you have 2 or more comorbidities, you have twice as likely to die as someone with 1 comorbidity, and 4 times as likely to die as someone with no comorbidities. This coronavirus is nothing like the coronavirus we're used to dealing with. It has made its own rules and has defined a new spectrum of disease, which is multi-system and which has to be managed in a way contrary to all previous principles. It is a novel virus, which means that no one was immune, and as such, it could run unchecked through the population. The virus doesn't discriminate. It affects men and women of all ages and across all populations groups. There are definitely people with asymptomatic infections who will inadvertently infect the people around them. It's likely that individuals may be highly contagious 48 hours before they display symptoms. There is as yet uncertainty as to whether you can become reinfected. There is no cure and no specific treatment for this virus. The lockdown gave us time to learn to respect this virus, to learn what medical interventions are likely to be successful and which inadvertently cause harm. And it allowed the country's healthcare system to prepare as best it could. We've watched and adhered to fluid and dynamic changes in protocol as to protect the healthcare workers, hospitals, support staff, and patients. Gauteng is just starting to see a steeping rise of its curve, and estimates of when the peak will be reached vary from the end of July till September 2020. Ironically, as the numbers rise and healthcare workers become more anxious, people seem to be behaving recklessly. Instead of being even more vigilant about wearing masks, maintaining social distance, and sanitizing their hands, they are showing an alarming tendency to make their own rules. People are frustrated by the restrictions imposed by the rules of lockdown. Instead of behaving correctly, they're having their hair or nails done, dinner parties, play dates, and are getting together with their families, amongst other things. The healthcare system is already stretched, and it's only going to get worse. There's no doubt that the irresponsible behavior will result in even more infections in our community than are now. We sincerely believe that COVID wards will fill up further, and we will have to take over some of the non-COVID wards. A time is coming where beds will not be readily available, personal protective equipment will be more difficult to acquire, and healthcare workers will be burned out. It's an exhausting way to practice medicine for nurses, doctors, and allied health workers who have all uncomplainingly just waded in. We, the Linksville Hospital team, are doing our best to protect ourselves and the people around us. It's imperative that the more vulnerable members of our community are protected to the best of our ability. It's thus unbelievably frustrating and annoying to see the imprudent behavior of members of the community who are ignoring the gravity of the situation and are conferring an unnecessary risk of becoming infected or infecting the people around them. COVID-19 can be very serious, and we desperately need to curb the spread of SARS-CoV-2. It can be done only by people respecting the guidelines rules. We implore you to please behave responsibly by wearing a mask over your nose and mouth at all times when out in public, even when exercising, by maintaining proper social distance, by not going out unless it's really necessary, by not allowing play dates, by not having dinner parties, by not taking off your mask during tea breaks and meetings, by sanitizing commonly used surfaces, and so on. There is only one way to halt the spread of SARS coronavirus 2, and that's to stop providing it with a substrate to live and replicate it. Now is the time we need to be more vigilant and careful to stop the transmission of this virus. While it's true that most people will survive COVID-19, not everyone does. I think that's pretty clear. It's pretty clear to me, and I think that I hope that you agree with me that under such incredible guidelines from the top pulmonologists in our town, why exactly would I open a shul? Just explain me why, after reading that, there's any logic in opening a shul. Now you're going to sit there saying school. I actually dropped off my 4-year-old at school today, my 6-year-old. And listen, under the school guidelines and the tremendous, I saw a picture of my kids sitting in school, and poor fellow sitting alone wrapped in his coat and everything, and like nobody even in remote distance. For him, yeah, it might be valuable. He's in pre-grade. He has to get ready for grade one. There are certain things, and they'll still make some kind of fun under the circumstances. But for a bunch of adults, as you saw, 50% of the admissions are 50 and older. So am I not supposed to have 50 and older walk into my shul? I might as well close my shul down. Most of my community and most of my involved community is over 50. So where does that leave me? So like for me, I'll be honest, I don't even see a choice. Like I'm not exactly sure why people think there's a choice under these circumstances to open. What am I opening? I'm opening a service where I don't allow any elderly to come in. There's no socializing. There's no fun. There's no food, no coffee, no interaction, no hugs. Everyone's sitting with their mask. What's the chances of me getting a minion? So at least these days, the four of us show up in the mornings, and even though it's only four, at least it's not that frustrating because you didn't have to schlep out in the cold. You sit down in front of your laptop and you daven together. Could you imagine showing up every single morning in the freezing cold to four people? And even less because suddenly Brian can't come because he's over 40, and Neville can't come because he's over 50, and Clifford can't come because he's over 50. So it's pretty much just me. So I'll be honest, like this idea of having a shul open under the circumstances is, for me, very, although I understand why people want it, people have to understand the product they're getting and what they think they're getting is very different. The product you're getting is stripped away from everything or almost everything you love about community. There is no socializing, there is no choir, there is no fun and games, there is no nothing. There's absolutely nothing. There is just davening. You're not even getting an aliyah. The Balkura is going to be getting the aliyah. And it discriminates against elderly. Not discriminate in a bad way, but in other words, it says that elderly people shouldn't be coming. And those are the people who most appreciate coming. So for me, under the circumstances, my argument would be quite passionately, what's the rush? What am I opening for? Now, if I knew that COVID is finishing in a month, and so for a month, we'll survive with this kind of minion, maybe, but practically, we're not going to be allowing elderly people back in until there's a vaccine, which is a long time away. Okay, so 6 months, 18 months, I don't know what it is. So me opening now, relying on people under 50 to keep my minion going is impossible because I never had 10, 15 people of that age joining. And I think it would actually hurt a lot of people knowing that the shul's open and they're not coming. But besides the fact, I don't think in my community it's actually going to work because the bedrock of the community, at least the daily consistent minion, is the people who are a bit older in years. So what's the rush? What's the rush? For me, and the way I'm seeing it is I have to figure out Rosh Hashanah right now. That's where I'm thinking. Rosh Hashanah is 100 days away. I think we just crossed the deadline. It's just under 100 days away. Okay, 100 days might sound like a long time. It's a quarter of a year, but for me, it's quite, it's relatively short. And in 100 days, we have to figure out how a community who usually shows up almost to capacity on the first night Rosh Hashanah, first day Rosh Hashanah, we get 80% capacity. First night Yom Kippur, we get 90 to 95% capacity. How exactly am I supposed to cater for a shul that cannot have 700 people sitting in one room together? Not a chance. That cannot have a choir? Not a chance. I told it to the choir straight out. I said, you guys are smoking if you think that you're going to be able to get up this year and sing. It's not happening. Which policy will allow hundreds of people to sit down in a room and allow the choir to sing, besides the fact that the choir has to stand together, and when singing, officially the particles that come out, if someone has COVID, is worse, and therefore there was actually a case of choir in Israel, I believe, that almost the entire choir got infected. So even practice for a choir is complicated at this stage, because when you sing, you're projecting the voice the most, and that's what brings out COVID particles. I can't have people singing with masks on, and I can't have a service that goes too long. So what happens to my choir? What happens to my chazan? And what happens to the community who wants to come and join together? I can't put 700 people in the room. Not I can't. It won't be allowed. Everyone's sitting together, literally, forget about 6 meters, 6 inches apart is not even there. Everyone's sitting in a packed space with the ventilation just going around. It can't work. So what do I do? For me, that's what I'm thinking about. That's what keeps me up at night. And that's what I'm talking to other rabbis about. Guys, we have to figure out Rosh Hashanah. And we're going to have 5 different minyanim all around the area. And how's that going to work? Outdoors? Social distancing? Do I have to arrange 5 chazans? Is it going to be the whole service? Is it just going to be the shofar? Am I going to get a bunch of people who are good shofar blowers to just walk down the avenues and just blow? You know, like the guy that goes down Trigoning, and everybody knows that at Trigoning at 10 o'clock in the morning, the shofar is going to be blown, and everybody goes out to the yard and hears the shofar. I don't know. But for me, that's the big question. What do I do Yom Kippur? People are going to fast 25 hours without going to shul. It's going to be a very long Yom Kippur. What do I do about sermons? Do I send out the sermons before? I don't think sermons are the most important thing, but a lot of people come to shul, they want to hear a message from the rabbi, especially on Rosh Hashanah Yom Kippur. What am I supposed to do? Send out my texts before and people sit down and read their own sermon to themselves? Like, I think people are going to be much more devastated by Rosh Hashanah than by now. And I would therefore keep my focus on getting that as right as possible. Sukkot, no shul sukkah, no brachas. What happens? What are we going to do? And those are tough questions because, as you see, according to them, the peak might happen in September. And Tishrei, the Chagim, Rosh Hashanah, Yom Kippur, Sukkot are the single most important month of a shul's calendar. And forget about all the things I'm talking about. Financially, it's also the most important month for a shul's calendar. That's when all the money comes in. How's the money going to come in? Why will people want to be giving money to a shul that they're getting very little value of? They didn't get their seat, so there's no point of paying subscription because they're not sitting anywhere. They didn't get a chazan, they didn't get a choir, they didn't get a sermon, they didn't get food. So shuls are going to have a real uphill battle then. This is child's play in comparison. Now, after Rosh Hashanah Yom Kippur, I'm not so worried because then the year winds down, and anyways, like big deal. So December, January, we're continuing to be shut. That doesn't worry me. Like the main part of a shul year, at least in South Africa, is April to October. The other 6 months, there's public holidays, there's long holidays. I just find it like it never gets its groove. Shuls are like a 6-7 month institution on the most part. But Chagim, that's where we need creative thinking. That's where we need to think out of the box. Does that mean I'll be walking around to 5 different shuls on the Chag, each day daven with a different minyan and speak over there? Will I be speaking facing the other way so that my particles don't go onto everybody else? Will the minyan for Rosh Hashanah only be for younger people? Will it be for older people? How long will the minyan be? Will it be for half an hour, an hour? Gentlemen, we have a situation. And that's why I think that the conversation about Shuls Open right now is, in my opinion, pretty irrelevant. And I'm not talking about from shuls. From shuls that people are coming simply, they want to daven with a minyan, and that's all they're looking for. They're anyways not big socializers. They show up at 6 in the morning, 6:30 in the morning, they come, they daven, they leave. Then there's a room to open. If that's all that, like there's some shuls that for them a bracha is literally a piece of kichel and herring, because that's not what people come for. They just come for the davening. Then under certain circumstances, yeah, open. My family goes to shul in New York right now. There's no socializing. You go in, you daven, you go home. But for our kind of community and what people are looking for within our community, I don't think that we should be offering a product which is so difficult and challenging for people. In other words, I'm going to offer a product that's actually going to hurt them. Sorry, you can't come in and you can't come in and you're talking too much and your mask is not on and you're being irresponsible. So then other people will say, Rabbi, it's not your problem. Let people be as responsible as they can. But a shul is a holy space. And if a shul is going to be a place in which anybody is going to get sick, how as a shul can we live with ourselves? It's not my problem that people go to the butcher or that people go to the grocery store, etc. First of all, I hope you don't socialize. When I bump into people in the butcher, I just talk to them for 5 seconds and I move on. Sometimes people might get offended, but that's the point. The point is we don't interact. But in a shul, which is a holy space, and it for me to become a place of sickness and heaven forbid death, I can't live with that. I just can't. Now, obviously, different people will have different perspectives. I would love to hear. I've heard from many, many different people amongst the community. Some people are passionate that we must open, and some people, including the doctor who I just read from, who are passionate that we shouldn't. And after having processed all the information, and believe me, there's a big part of me that wants to go back to shul. As much as it's nice to be home every single day with my kids, I want a routine. I want that morning. I want the coffee. I want the chat. I want the meeting face to face. Yes, I do appreciate the alone time in a way because I do like being alone, but I'm not going to say that I don't miss at all the interaction. I miss the interaction deeply. The non-variable parts. But because I miss something or I don't miss something, that should never affect my decision making. My decision making should not be based on what Levi Avtzon wants or doesn't want. It's about what the right thing is. And the executive, myself, the executive of other shuls, other rabbanim, and people who have delved into the matter, I haven't seen any major excitement on behalf of any leadership of any of the big shuls in this country to open shuls. So that's my case. I would love to hear your thoughts, but my case would be straight out that I don't see the point of rushing into this. Let's breathe, take it one step at a time. Let's figure out Rosh Hashanah. If we're